Everyone, and welcome to Valley View University. I'm Bob Etemad. I'm the interventional endoscopist here at Valley View Hospital, and it's a pleasure to be with everyone this afternoon. I have a few housekeeping things to address before we get started, just so everyone is aware. You can submit questions through the Q&A chat at the bottom of your screen. Your questions may be answered at the end of the presentation. We try to triage them for timing and appropriateness. Um, we will do our very best to leave time for that. Please remember that we don't want to share any private personal health information in any of the Q&A. So with that, we're going to get started. So today's presentation is going to be focused on how gut health supports longevity, the science behind the microbiome, and healthy aging. The reason I thought that this topic would be important is that there is a tremendous amount of interest, again, in the microbiome and in healthy aging overall in our community. And there is discussion now regarding the relationship between the two. And I thought that I might try to at least provide some foundational pieces of information that would help you navigate the landscape when it comes to these issues. Remember that any medical issue that is specific it should be addressed in the doctor's office, and we're not here to provide specific information, but more broad principles that might guide your health information overall. So I wanted to start with this issue of longevity. And obviously, longevity, it can imply the ability just to live a long life or the ability for something to last a very long time. But remember that longevity has to also be laid against the issue of healthiness. I mean, if we're looking at this graph here, if you see, for example, this red line as representing your health, as one goes through time and is in this top portion, let's say, of feeling healthy, over time, it is very common that as we get older, what we would consider as healthy becomes a little less, and we begin to experience some health issues. And eventually, all of us do pass away. And the slope of this line is what we're trying to address. We're not only interested, of course, in a long life, but we want the quality of our life to be as good as it can be. So longevity is not just about the length of your life, but there are other factors as well. Some people address this issue of performance during your life, and looking at your overall, I'll say, quality and when it's becoming healthy or not healthy. I found this graphic and I thought it was quite interesting in that at the beginning of life, we're basically trying to avoid health issues, or we're coping with subpar health issues. Um, we're always looking at performance. I think whether it's athletics or other issues, I think many of us are trying to look at peak performance while we maintain our health and longevity. This was an interesting slide too. It's from the same website, slowmyage.com, which was just an interesting place that I bumped into. But it described the concept that as we look to increase performance in our life, whatever it might be, cognitive performance, physical performance, that we have to remember that it actually may have an impact on both our longevity and it may impact the quality of our life, particularly at the end of the life. And I would say that an example would be that if you're burning the candle very brightly and very hard, you may end up, I don't want to describe it as paying for it, but you want to consider the fact that there are behaviors and ways of living that may end up impacting you in the long term. I guess a very good example would be extreme sports in some circumstances where you end up having some consequences of some of those extreme sports in your later years. So all of these things are important. Now, what we do see in general is that when it comes to longevity, genetics are important, environment more important, lifestyle probably the most important. And what we're beginning to try to understand is what role does the human microbiome play overall in longevity? And there is more discussion in the scientific literature that suggests that the microbiome will play a role in longevity. Exactly how it is doing that, we're still learning. Um, and I'll get to that now, those fundamental principles. This is a common saying that I think that when it comes to whether it's the life that we live or the food that we eat or the time that we spent with our hobbies, we will see likely the consequences of the choices that we make. And as I scoured the internet, I saw that there are many different scientifically based one-liners that address the issue of what are some of the secrets to a longer life. Protecting your DNA is a sort of general principle. It would be anything from avoiding radiation and avoiding exposure to certain substances to diet and exercise. We all are aware that tobacco use has a significant impact on our health and that the increased risk of cancer and destruction to the lung itself is associated with tobacco. But sleeping has an impact on the quality of our life. The types of friendships and strong friendships does have a direct impact on the quality and the length of life. Choosing friends with healthy habits, and then some of these eating things like Mediterranean diet, keeping your weight at a reasonable level, minimizing alcohol use. We don't want to forget about flossing because actually oral health has an impact on both the quality of your life and longevity, physical life. And then these other things, while I'm not addressing them in the microbiome, are just important to remember. It's a holistic thing that we have to look at. Having some type of spiritual life has been shown to increase longevity. Being a forgiving person seems to have impact on longevity. Of course, both in youth and getting older, safety gear when it's appropriate, knowing how to manage your stress, minimizing negative self-talk, living a purpose-driven life. All of these things are very important when it comes to longevity. We're going to obviously focus on issues with diet, but I wanted to share that this is just one small piece of the overall um, mission that we should all be having when it comes to looking for a quality life and a longer life. The fascinating thing about your gut is that you as a human are essentially cocooned by your squamous epithelium, the skin that is not fully waterproof, but it is highly water resistant. And that then we have some openings to that, um, mainly the nasopharynx or the nose and the mouth. And then as we ingest things, that external environment is interacting with our internal environment. And between this external and internal environment, we have this mucus layer, inner and outer mucus layer that provide the initial protection, followed then by a lining on the inside of us that is processing all these things that are foreign to us to assure that we are being protected and we are distinguishing danger from safety. Then in the colon, there is a tremendous amount of bacteria, virus, different microbes that are basically processing some of this material to help do further uh, uh, get a further understanding of what's happening on the inside. And, when it comes to the bacteria on our skin or the bacteria in your urogenital tract or the bacteria in the gut, we have trillions of microbes that are working synergistically to protect us. Now, what these microbes do is the essence of the science that we're trying to basically further to use to further understand what the value is. So I've listed a few things here. There's a barrier function that those bacteria provide. They actually have a nutritional component. There's immune modulation that is important. We have metabolism of certain substances or the creation of certain substances that is important. The infections and protection against infections by having these microbes there are important. And then metabolism and absorption of either drugs or other things also are important. And the microbiome is playing a role in all of these things. As a general principle, we do see that the diversity of the microbiome is important in its ability to do what it needs to do. When the diversity seems to become less, it seems as if the microbiome as a whole is more uh, susceptible to being damaged, and it is less capable, as broad statements, of doing the things that it's being asked to do, or that it has come to learn to do for us. And I'll go through some of those things generally. So that the point of that is that we don't think of specific individual microbes as good or bad by themselves. And I share this because I get patients that do come here with some uh, uh, assays that come from companies that I'm not quite familiar with, and they list the different bacteria that have been measured in their stool. And I'm sharing that right now, if you look in the literature, it's not clear that all people over the age of 60, for example, should have one certain microbiome, and all people under the age of 20 should have another microbiome, or that women should have a certain microbiome and men should have another, or that certain ethnicities or certain populations should be in certain categories. So it's very difficult now for physicians or healthcare providers to be specific, and these assays are being used now to sort of, quote, manipulate the microbiome. And I'm not sure that we have the science yet to be so specific to say that somebody's microbiome should include 10% of this, 3% of that, 1% of something else. We're still learning. Dysbiosis is generally something, it's a general term where the microbiome has moved from what is considered normal to something that is more unhealthy, as manifested by a change from their previous healthy state. And it generates these issues as you might expect. There can be an inflammation, there can be a dysfunction in the gut barrier, there can be an altered immune response, and there's a metabolic dysregulation that can affect glucose metabolism or fat metabolism, which then may lead to some other health conditions. So I'm going to go through that quickly. We do think and we do see that it is true that food can shape the microbiome. Now, whether someone in New Mexico has a different microbiome than somebody in Colorado, it's very likely that they will. If somebody has lived in New Mexico for 15 years versus somebody that's been there only a month, they may have a different microbiome one between the other. Um, and it's very likely related to diet and the foods that are available. We make general statements now, like high fiber, whole food diets enhance beneficial microbes. And I think that's a fair statement as we look at some of the data that's coming out when it comes to the use of emulsifiers or processed foods, where it does seem to change the general context. But again, we're learning how significant those changes might be and whether or not what are the longest lasting effects related to that. We also know that the microbiome changes with age. So this is a very busy slide, but anything that is established data is in green. So here we have different areas that are green. So we see that, for example, there are certain microbiomes that can change the way that the cells in the colon, for example, are actually operating. This histone acetylation, that's how genes are turned on and off in the colon. And so we see that it is possible that the environment that a cell is living in may impact the way a gene is functioning and the proteins that it produces and the function that it actually might have. So we see that as we get older, it's not so surprising that there are some changes in that. We see that the microbiome also does change with age. And I think that we're seeing that, and we're talking about each of these, that there are changes in inflammation. The term is inflammaging as a term. Metabolites are changing. Modulating nutrient sensing pathways is important. And we'll go through each one of these. And then the gut organ axis, which we'll talk briefly about the gut brain axis, but the gut immune axis is also related to that. As a general principle, the gut is providing a barrier between what you take in and the internal world. So we have millions of antigens that we are exposed to, that is foreign proteins and foreign substances. And in general, we pretty much want there to be a barrier between the internal parts of the cell and those proteins, because the body, once it senses that there is something foreign around, it's going to trigger a response by you. So an example would be that when you get cut and the outside world is exposed to anything under the skin, you get a redness in the area. It gets inflamed. It can get pus can develop in the area. These are the responses, the inflammatory responses associated with the outside world being exposed to the inside world. And so if there is a leaky gut, if the space between these cells is not as tight as they should be, to use that terminology, then the internal world gets exposed and it generates an immune response. And then that can create trouble for the patient. So inflammaging is basically low-grade inflammation that develops with age in the absence of an infection that may then generate other medical conditions. It is thought to be caused by a loss of some of the inflammation, systemic inflammatory cascade that results in overstimulation of the immune system. So as an example, arthritis, many people don't have arthritis when they're young, but as they get older, they notice that they're getting stiffness in their joints and they're getting joints that are getting larger. This is a reflection of the immune system becoming a little less controlled, and then you're seeing inflammation in the joints, and that can happen in other parts of the body. There is active research being done. This study, for example, the health relevance of modification of low-grade inflammation and aging and the role of nutrition. That is it possible to reduce inflammation, this low-grade inflammation that is associated with aging through nutrition, through changing your nutrition? And I know there are many influencers out there and many people that tout over-the-counter potential remedies for this type of thing. Um, I'm sharing that we're working on it in a peer-reviewed way in an attempt to be as specific as we can be so that we can offer guidance that's science-based when it comes to these things. So there is a literature on this, and you are able to research it on your own as well to see what we're learning. I'd say that right now we do think that we have preliminary data that suggests that this low-grade inflammation can impact the development of malignancy, can lead to the susceptibility to infection, can change body composition as we get older, can lead to some changes in cognitive testing, type 2 diabetes, atherosclerosis. So all of these things are important, and I'd share that don't forget about the mouth, making sure that your dental care and that your oral hygiene is in good shape, because we do see associations between worsening atherosclerosis, for example, and oral hygiene, and issues that are related to the susceptibility to systemic infections and oral hygiene. So I bring that up only to mention that with all the bacteria in the mouth, that plays a role as well. So this again, it is in the popular press. Maintaining a youthful gut microbiome can slow aging. They always and often use sensational titles in a hope to, one, get you to read their magazine, but I think that there is some truth in some of this. I think that whether or not we have a way to manipulate the microbiome to make this better is still something that we're continuing to work on. So what are some of the things that we know of scientifically that impact the microbiome? Now, this is not saying that by manipulating it, we can affect your health, but we are saying that these things impact the microbiome. And I've shared this before, but remember, the mode of your delivery, even at birth, your gestational age at birth, whether you were breastfed or you were not, whether you had antibiotic exposure, how much skin to skin contact did you have early in your life, mom's microbiome and mom's health, and then your own genetics, your age, the status of your sex hormone profile, your own immune system function, and then all sorts of antibiotics, whether PPIs are a regular part of your life, the use of non-steroidal steroids, of course, chemotherapy, artificial sweeteners, emulsifiers, and then your social factors. Are you living rurally? Does you have a large household or a small one? What do you use at home? Are you regularly using antibacterial soaps or not? What kind of travel you do, what your dietary patterns are. And then of course, what type of diet are you eating? How much fiber? Is there fermented food in your diet? How much processed food and what your sugar intake might be? Red meat. Each one of these things that I'm listing here, including your sweet sleep, physical activities, stress and cortisol levels, smoking, vaping, geography, air pollution, pets in your life. Each one of these, if you go into the medical literature, we know that these things impact the microbiome. The question really is whether you become a dog owner or a cat owner, does that really impact your microbiome in a health related way. And and those are the types of things where it's fun for people to speculate. And sometimes people are going to say things that are not as scientifically based and say something like, well, you should get you should definitely get rid of your dog, or you should definitely get three cats and not just have one cat. Those types of things are things that we need to be very careful of when we hear them, to use a critical mind and critical eye before you just take it as verbatim. One of the other things we are learning is that these bacteria are actually producing goodies, producing things for your gut and for your body that seem to lead to a healthier situation when they are good, when it's a healthy microbiome. This is a very busy slide. These are showing CFA stands for short chain fatty acids. And these types of things, tryptophan, the metabolites of tryptophan, inflammatory cytokines, bile acids, uh, neurotransmitters, all of these things are being produced, we see at a certain level that can affect satiety, affect to some extent, perhaps some cognition and brain inflammation. I mean, again, we're looking at it in more detail. Peristalsis, the production of focal hormones. ENS is the enteric nervous system. There is a nervous system in the gastrointestinal tract that helps it to move appropriately. And then how we, again, metabolize glucose and fat can have a significant impact overall um, in affecting brain, GI tract, liver, and the cardiovascular system. We talked about atherosclerosis. So short-term fatty acids that are produced. This is busy, but again, it says that it can impact your satiety. That would impact your weight and your desire for food or even specific types of food. These are all good things that it seems to do. Um, Trimethylalanine N-oxide, TMAO, you may see this in some of these panels that are being sold, and how much you produce. This is actually a negative uh, 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 metabolite of the microbiome. So the point of this is not to say that eggs, milk, meat, and fish are bad because they lead to increased levels that are associated with cardiovascular events. It's more that some people have a microbiome where when they do have these things, they're more likely to produce this substance, which then can promote the development of atherosclerosis. And what's fascinating is that we do know that certain peoples and certain cultures are much more likely to develop consequences of certain diets than others. So, for example, the Native American population and the Pacific Islander population has been found to be much more sensitive to high fat and high carbohydrate diets than the Northern European population. So we should take these things into account when we are again, let's say, getting these if anyone is doing these panels, to remember that it's not just about this single number, but it's about the genetics and about how each individual, perhaps ethnicity, handles these particular substances as they go. We know that tryptophan it's an important byproduct of the microbiome, and that it has many immunomodulatory effects and affects insulin as well. So bile acid's the same. You know, we make bile from our liver, but bile is broken down into secondary bile acids in the colon, and those secondary bile acids and the relationship between primary and secondary bile acids is an important contributor to health. Again, we're still learning. Yes, you can give somebody a bile acid in a pill, But does that really impact the microbiome in a healthy way? I don't know that we know that for sure. Polyamines are also something that are produced by the microbiome. And again, there's a potential for many different positive effects. And if you were to Google it and research it, you would see that there's a lot of research on how the microbiome can have an impact on those types of things. Your gut also produces many of these vitamins, many B vitamins, vitamin K. And so what role does that play in health? And if you have a different microbiome, are you getting less of these vitamins to a clinically significant level? I think we're still learning about that. So all of these things, short chain fatty acids, TMAO is a negative tryptophan metabolites, bile acid, and metabolites, polyamines, and bacterial vitamins are all things that you will read about, that you will hear, that can be improved. But again, we're still learning about balance and how each individual it has a unique role. It has a unique role in each individual. The gut-brain axis is something that's been talked about significantly. How does what you eat impact your most I'm going to say the organ that drives much of our life. And is there a way, is nutritional psychiatry a real thing or not? If you look it up, you'll see that nutritional psychiatry is now becoming more and more of an area of interest. And we clearly know that overtly there are ways of uh, changing, I'm sorry, that changing the microbiome may have an impact on some things. There was fascinating work that was done where they gave the microbiome of an older mouse um, to a younger mouse, and they found that certain substances and even some behaviors were changed as a result of changing the microbiome from an older mouse to a younger mouse. And they did the reverse. They gave an older mouse the stool of a younger mouse, and they found that there was some rejuvenation as defined by certain characteristics in that older mouse's brain. So what does that mean? Does that mean you should go and collect the poop of young people and inject it into the poop of into the colons of older people? Of course not. But I think it leads to some very interesting questions about, can the microbiome make an impact in brain health and keep us younger by doing things? And if the diet has a role in the microbiome, and a younger microbiome, so to speak, it rejuvenates the aging brain, well then yes, we're hopeful that maybe there are some things that can help some people some of the time. We do see that there are specific microbiome signatures that are associated with Parkinson's or MS or Alzheimer's, and that we see, let's say, certain bacteria that are more, and we see certain bacteria in people that have a more positive mental health. But it's a chicken or the egg thing. We continue to better understand what that might be. Um, this is an interesting thing. Eric Topol, who used to be at the Cleveland Clinic, who's now at Scripps, has sort of done some brain age gap sort of general concepts where he says, okay, people with diabetes, with a hemoglobin A1C, manifest certain things that give their brain age a couple of years in addition to their chronologic age. And it may very well be that if things like this are accurate, that if the microbiome can have an impact on glucose homeostasis, then perhaps that can lead to more a younger brain through dietary manipulation. But I'm thinking that I'm sharing that it's a little bit speculatory. Remember that we already know that it's very likely that cancer can be impacted through exposure or non-exposure. We know about genetics, certainly, but lifestyle through exercise and stress management and proper hygiene can reduce cancer risk. And that it's probable that there's good correlation now between certain diets and cancer risk. So it may very well be that the microbiome is serving as the intermediary between some of these factors, and maybe even the lifestyle factor. I'm sure many of you heard of these blue zones. Blue zones are regions in the world where, in general, the usual number of people live much longer than average. And these are the blue zones that are documented in the world so far. Um, you can see that in Loma Linda in the United States, for example, is reflective of one of those. And we have Costa Rica in Italy, Greece, and Japan. These are some of the common factors in these blue zones, and some of them are dietary related, mostly plant-based foods, meat servings that are small, meat servings that are only about 5 times a month, habitually fasting or restricting caloric intake. In other words, you're sort of going to sleep a little hungry, alcohol in moderation, a sense of purpose in life, active natural movement, having, again, a sort of a purpose-driven life, stable extended family structures, support networks. But you can see that there are dietary issues that are similar. Again, we look and see what the relationships are, and perhaps that might have an impact. This was a very interesting study where they looked at people over the age of 100, and they looked at their poop, and they said, what is common among people that are over the age of 100 as compared to others? And here they found, in this particular case, that this particular form of lactobacillus they were high antioxidant activities associated with this bacteria, and that's something that they had in common. I think that these types of studies are the types of studies that we're going to continue to want to get to see those people that are living longer. What do they have in common between one another from an exposure standpoint, lifestyle standpoint, and if they are coming from different cultures around the world, it would help us then perhaps uh, uh, become more familiar with that way, and perhaps prescribe it as a way of living. So, as I shared, yes, we do see the microbiome is different in type 2 diabetes, obesity, non-alcoholic fatty liver disease, atherosclerosis, people with hypertension, depression, anxiety, autism spectrum disorders, Parkinson's. All of these have different microbiomes. The question is, how much is it the chicken? How much is it the egg? And that's where I think we're going to continue to be developing protocols to help us better understand the role that it has. But um, I do think that we're going to see that there are ways to to live and eat that will keep our brain healthier and younger. I think that it is valuable to continue to ask these questions and get exposure to the concept of a healthier living for a healthier brain. But I want to caution everyone to be thoughtful and not to be influenced too quickly by very uh, broad-based claims, because I think we're still learning a great deal. So these are the things that I think are fairly well established, and it's not so surprising, right? Fiber seems to be a primary food, a fuel for beneficial gut bacteria. Please continue to use fiber and a lot of fiber in your diet. And we know vegetables, legumes, oats, barley are all helpful. These are things that you're easily going to be able to find online as far as a healthy prebiotic diet. I won't go through each of these, but fermented foods can help live bacteria in the colon also. You can see it's all about finding a balance, though, and we don't want you to get so sick on your kombucha that you're not able to, eat the other things that you like. Um, I'd say that ultra processed foods, we're still learning. It's fascinating because, as you know, the current diet in the United States, more than 50% of the calories that we ingest are from ultra processed food in general. Um, this is the Mediterranean diet pyramid. And I think that you can go ahead and look that up. And we're learning how to classify what is a ultra processed food versus an unprocessed food or minimally processed food. So I think for you to continue to read and learn as we are all learning as a culture together, and see if you can emphasize in your life the use of the ingredients that are more on this side, that's probably something that we're going to see a benefit to. I think this is a safety statement as well, a safe statement to say only when necessary. We really want to be thoughtful about antibiotics. Please, I would say that I think many physicians and healthcare providers are interested in minimizing antibiotics if needed. I mean, when there's something that's coming up that we think might be an infection, but we're trying to see if the statistical likelihood is self-healing. I think that we're going to want to do that. Exercise is truly one of the things that does seem to have a major impact on almost everything. And regular physical activity is crucial. We're very fortunate to live in an area here that is the environment is so promotes a healthy, active physical lifestyle. Um, how each person manages stress and addresses sleep is also very important. I think each one of us learns a stress response. Some of us do it in a good way, some of us do it in a not so healthy way. And learning to address your stress response and find sleep is something that we talk about over and over again. And there's so much literature on this now. So remember, the bugs inside you are not all bad. And I hope this gives a basic primer to some of the issues that we're looking at. There's so much literature for you to look at on your own. And I hope your journey in discovering what is true and what is not true continues. And I appreciate the time you've offered today. Thank you very much.
What are the symptoms of a leaky gut?
So the symptoms of a leaky gut are we're still develop them. There are overt, I'm going to say, disease states where we think leaky gut has a role in, for example, ulcerative colitis or Crohn's disease. Um, the term is not a scientific term uh, that is always applied, but I would say that when we see evidence of low-grade chronic but persistent inflammation that may be manifested in a sedimentation rate or a CRP, uh, I think we begin to ask ourselves, what is driving the inflammatory state? Um, but I would say that as a term, when people have a disruption of their gut epithelium, it's generally going to be signs of chronic inflammation, which will be the elevated sed rate, a CRP. It may be malabsorption, maldigestion. It may be inappropriate weight loss based on the number of calories someone is taking. It may be that you have an intolerance to certain food groups. Those are general statements.
What extreme sports reverse longevity?
What extreme sports reverse longevity? Well, um, I'm not an expert on all extreme sports, but I'd have to say that I don't know that there's a single answer to that question. I think that how people deal with an extreme sport, I might say one extreme sport that's easy to define as an extreme sport is an ultra marathoner. And people handle that sport differently, metabolically, muscle and joint wise, how they deal with their diet and their nutritional support during that experience. Um, so I have difficulty answering it because I think we would need context before I gave a broad generic answer.
Is antibacterial hand soap good or bad?
It's a wonderful question. So I'm in general, I'm going to say that in the healthcare community and here in the hospitals where we're working, because we're exposing people to ourselves, and we do not want to transmit anything from one person to another, we choose to deliberately use the hand sanitizers and washing our hands because we don't want to take the risk of inadvertently exposing somebody from one thing to another. I think that the use of antimicrobial substances in the home, I think we're still learning because on one hand, it may promote the development of resistant bacteria in that scenario. And I think that in doing that, we put people at risk for higher acuity and more resistant uh, bacteria that will potentially lead to health effects. So I, and I think that each individual household is a little different. So there are some people that are more exposed to bacteria that may be pathogenic or from other people. So I'll leave it at that.
What is the best way to get protein on a plant-based diet?
That's a great question. And I think that again, if you were to spend a little time online, there are helpful guides here. I think our legumes are a huge source of underutilized plant-based protein. And so I'm going to say um, legumes in general. I think we all know that our soybeans are used for protein. So that's a start.
In addition to seeing you as a patient, what are scientifically based sources of information you would recommend?
It's a great question. So I'd say that um, the National Library of Medicine um, uh, is probably our best our best source. Um, and you can just Google National Library of Medicine, and you will have access to the entire scientific database. It can help you to make the language more comfortable as well. Um, and these are a collection of peer-reviewed resources, the National Library of Congress helps us to collate that. And I would say I would go there first. They do have I'll call it an uh, alternative medicine database also that is distinct within that database if you're interested in that as well. But I'd say that's our first line of defense when it comes to getting information that might be more likely to be accurate. Remember, science inherently will collect data that conflicts. It shouldn't be something that should bother you. It should be that the way science is built is that we create a system, we test it, we get data, and conclusions are drawn based on that limited set. But science is about comparing and contrasting the data sets and seeing how we can come up with something that's most reliable. But that's where I would say science is most helpful.
How would somebody know if they have chronic inflammation?
So when somebody comes in and they have a symptom of anything, inflammation is a scientific term, actually. Inflammation implies uh, a redness, puffiness, um, a symptom of some type. Some inflammation is not overt. You can have inflammation in your bile ducts and you won't know it. You could have inflammation in your kidney and not feel it for a long time. So I'd say that there are blood tests to check for inflammation. There are overt symptoms for inflammation, and some inflammation is asymptomatic. I know it sounds like I'm hedging the question, but it's not easy. Um, I'd say that everything starts with symptoms, or if you're doing a screening test with some blood test or some other imaging or some other testing that gives you some idea. So it's a hard question again to answer. You're not going to know as easily all the time.
Can you explain how the vagus nerve impacts the gut and motility?
So the vagus nerve is a very important nerve when it comes to motility. The vagus nerve is almost like a spider web that touches the stomach, it touches the small bowel, and touches the colon. And in general, the more stimulated the vagus nerve is, the more activity we see in the organ. But the vagus nerve is connected to the spinal cord, connected to the brain, and how that vagus nerve is then, and its activity is then modified is highly complicated. Everything from how much you eat, what you're thinking, whether you're scared, whether you're calm, all of these things affect the vagus nerve. So that's a book in and of itself. Yeah.
Should somebody talk to their primary care provider about abdominal gas/bloating if they think they know what the cause could be and they think the cause could be beans?
So I think that if someone is feeling like their bloating is not normal to them and they're feeling a different substance, by all means, I think vetting it with your primary care physician is recommended because I think you're going to then get the listening ear of someone that's hearing the complaint with some degree of critical thinking and then training, and that may help in then sorting out what might be the source. Because yes, it could be the beans that are being eaten, but it might also be something else.
I see people always prioritizing protein in their meals. Should I also be prioritizing fiber as well?
That's a great question. So the current guidelines, dietary guidelines have been shifting and moving, as you know, and we live in a complicated world right now when it comes to guidelines, because the influence of time over time, uh, guidelines have become a little bit uh, more vague because they come from different sources. I think that still um, most guidelines are still recommending uh, a higher fiber diet. We see that It does have an impact on stool behavior, stooling, how we stool. It does seem to help with uh, cholesterol. It does seem to help with um, some levels of inflammation as well. So high protein versus high fiber, you can do both. You can have a high protein, high fiber diet. Um, One does not need to sacrifice the other.
Continuing to talk about fiber, do you recommend fiber supplements to get adequate fiber?
I think it's preferable to use whole foods to get the fiber. If you really cannot use the whole food, then you would use a supplement. A supplement, the supplements come in different forms, as you all know, and that uh, people respond differently to psyllium supplement versus supplements that might be citrus based. I think you're going to need to find what makes you least gassy and gives you the regular, let's say, regular bowel movement. Um, so I think whole foods are better, but if your recommended allowances are not enough with whole food, then you're going to want to get it through a supplement at this point.
All right, we only have time for one more question. What is someone's next step to ensuring they have a healthy gut microbiome?
Yeah, so I'd share this. I think that those last recommendations or thoughts would be where I would leave it, where we want to continue to use a diet that's higher in fiber, generally less ultra processed foods. I think having a whole food based diet in general is probably best. Cooking at home and knowing what ingredients are in your food are probably, and doing that more than less, um, is probably going to be something that promotes the microbiome. Or if you're going out, perhaps those places that you're eating out speak specifically to scratch kitchens, for example, that are supporting that type of thing. Um, I think avoiding antibiotics and unknowns in your life are probably unknown supplements are probably also to your benefit.
And if you would like to get in touch with the Gastroenterology Center, you can call 970-384-7510.
Great. We'd love to hear your feedback from today's presentation. I think there will be a survey after this. If you feel comfortable to share your thoughts, please do so. And there will be an email that will offer you a link for a recording from this presentation. Thank you very much, everyone, for sharing your time with us this afternoon.